According to the latest report released by the Department of Veteran Affairs in November of 2020, the number of U.S. veterans who commit suicide each day is holding steady at just under 18. And there were no indications that the COVID pandemic resulted in an increase in suicides. Positive news yet, 18 lives lost per day is still way too many. In this week's in-depth discussion, Susan Cadot and her guests discuss what's being done to lower that number.
Yes, thank you, Rich. We have an important topic to share with our audience today, so I'm just going to jump right in. First of all, I'd like to introduce our panel to you, coming from really all over the nation. First of all, we have Sergeant Major Michael Barrett, who is an American Legion member and the 17th Sergeant Major of the United States Marine Corps, 40 years in the Marines, so he's done a few things and seen a few things. We also have Dr. David Belcher, who is affiliated with Loose Horse Psychiatry in Abilene, Texas. He's a retired major and is a veteran himself. And then we have Captain Aaron Ashworth, who's with the Oklahoma Army National Guard, captain and a chaplain, a licensed professional counselor, and with the Mental Health and Suicide Prevention Programs Administrator for the Oklahoma Department of Veterans Affairs. What a panel, what a lineup to discuss this very important topic. Gentlemen, thank you for being with us.
Thank you. Good morning.
Thanks for having us.
Captain Ashworth, I want to start with you. Oklahoma has a higher veteran suicide rate than the nation. How much higher and why?
Through the VA reports that we receive and kind of banking that off of some of the state data we have, that Oklahoma has a mean average of about 112 suicidal deaths per year when it comes to service members, veterans. And the reasoning behind that vary. I mean, when we talk suicide, there's varied reasons behind suicide. It comes down to life protective factors. And what are we doing to be able to promote life protective factors? And so in the midst of looking at this data, the SAMHSA, which is the Substance Abuse and Mental Health Services Administration out of DC, did a population gap analysis of Oklahoma and multiple other states, and offered both our mayors and our governor an opportunity to look at through a public health approach and building a collaboration what those issues are and what's causing such a high rate in Oklahoma, and what we can do, what kind of action plan can we build out, which is the program I work on how we can reduce those numbers year in and year out.
Sergeant Major, I want to come to you next and talk about your work with the American Legion in trying to bring awareness to this tragic issue and your own personal experiences with it.
I'd like to tell you that the American Legion just announced this past Memorial Day weekend, Poppy Day to be exact, that it is activating the full might of the nation's largest veteran service organization to win the race to end veteran suicide. And to steal a military phrase, the American Legion is going to attack this issue on all fronts. We're continuing to fight for legislation that will bring about real and tangible solutions. Second, we're going to leverage our vast footprint over the 12,000 American Legion facilities and communities across the country to establish peer support programs. Third, we know that more research is needed. I'm sure Dr. Belcher and the captain will jump on board with this, but we will share our findings to help make impactful changes. And to do this, we're committed to continuing to raise awareness on this critical issue, raise money needed to make an impact, and to raise the strength of the American Legion. Because one thing that we've learned in the military is battles are won with an army. Not a single soldier. It takes an army of influencers.
Major Belcher, I want to come to you as a psychiatrist who treats folks, veterans battling with depression, maybe thoughts of suicide. What do you see? What are the issues that they're struggling with, and what kind of help do they need?
The main thing is to seek to first to understand before being understood. So listening to others when they come in. One reason, I don't look like a doctor. I have tattoos and some long hair. To make people feel comfortable to come in and talk to a provider, someone that will listen to them and feel heard, so they know that they're not alone. Just like Sergeant Major was talking about, it takes an army. It does. We can't do it alone at all. So first of all, building rapport with patients and listening, getting their history of whether they've seen other providers or not, their family life. Most of the time that patients, especially veterans, they don't come in unless a family member will have them come in, their wife, or there's issues at home with their kids. So there's the stressors that in the home life and their occupational life, difficulty holding jobs. And then there's a lot of resistance to medications. And a lot of that is because medications can have a lot of side effects, and it's definitely based off of an individual's DNA. So I personally do a lot of DNA testing. There's options now for veterans and others that, are friends or family members of veterans that are having issues with depression and anxiety, and then maybe have had a bad experience in the past with adverse side effects to meds. So there's actually testing now that's funded through the VA that, it would be paid for, but to gear medication management specifically tailored to that individual. So there's no more, so to speak, what I call guinea pig medicine. There's a biological change that happens within the body, in the brain, that not only affects someone, that a service member that's gone through, wartime or, military sexual trauma, witnessed a friend pass away, that kind of thing, a family member pass away. It affects them mentally and also physically. Getting on proper medications along with therapy is huge, but it winds up affecting, pain increases, cardiovascular disease, heart attacks, strokes, diabetes, insomnia. So I do a lot of education. I listen, build rapport, and then present options for, therapy options and also medication management that's specifically tailored to that individual with great outcomes.
I'm sorry, it sounds like a vicious circle to me, Doctor. Captain Ashworth, I want to ask you, in Oklahoma, how are we addressing this problem? I mean, clearly there has to be a personalized one-on-one. When the doctor is talking about DNA, how do we do the one-on-one personalized care and provide widespread access?
From the state level, what we're doing is we have a program that's called the Oklahoma Governor's Challenge, and then Tulsa, Oklahoma City, and Lawton have the Mayor's Challenges. And what those are basically are public health approaches through building a community collaboration to let veterans know, service members and their families know what resources are in their community. One of the biggest gaps that we found when going across the state and kind of doing our gap analysis, the thing that we kept hearing was, I just don't know where to go. Like, we have the VA, but if outside of the VA, we don't know where to go for other services or other resources. So we were really prone on developing online mapping system that shows all the different resources for veterans in the communities, but then building that community collaboration and then getting direct mailings out directly to that service member, directly to those families, directly to the community stakeholders, and directly to the healthcare, mental health care providers to talk about best practices, to schedule training of what does it look like to have best practice training? What does it look like to know how to work with the VA? That way, as a community provider, you have that connection back to the VA and know how to operate. That if there's something that they need specifically, that you can be able to provide it or resource the person that needs to be able to provide it. So it's really about building that safety net. How can we build that community safety net across the state that allows us to reduce those numbers?
Something we talk about a lot, and Sergeant Major, I want to come to you for this because 40 years in the Marines, I know you've seen this firsthand. Are there some folks, some veterans, no matter what programs are available, they don't want to access it? Is that a problem with getting veterans to access health care? What do you think?
Well, I've seen some of the statistics that are outlined in the national strategy for the prevention of suicides, and it's less than 50% are actually utilizing the VA healthcare system. When we talk about making a smooth transition from the armed services to civilian life, every single service member from every single branch of the service is required to attend a transition seminar. In the Army and the Air Force, they call it GPS, Goals, Plan, Succeed. In the Sea Services, the Marine Corps, the Navy, the Coast Guard, we call it TRS, Transition Readiness Seminars. It is an outstanding program, and it has evolved exponentially. It covers down on individual transitioning plans, financial planning. The Department of VA, the Department of Labor get involved with their transitioning. You have pathway training. In other words, are you going to just get out and get a job? There's pathway training for you. Are you going to do an entrepreneurship? There's training there for you. Are you going to do training with HVAC? There's training just for that as well. Or are you just going to go back to school? You learn how to write resumes, you learn how to dress, you learn how to do interviews. We provide every single resource you could possibly think of. Second, You need to take your final physical and your VA health screening seriously. From your nose to your toes, you need to tell the doctors every single thing. Keep a copy of every medical record of everything that's ever happened to you so that they have a full understanding of you. Third, stay connected, and I can't emphasize this more. Stay connected. Join a veteran service organization like the American Legion or any other military service organization like the Marine Corps League or Marine Corps Association. Every branch has a similar organization. Stay connected, because just because you've taken off the uniform, it doesn't mean that you have to stop serving. And lastly, as soon as you get to where it is you're going to end up and start building your home, meet with your county veteran service officer. They will walk you through all your veteran benefits. They'll help you get signed up. They are an incredible resource, and they will help you navigate through all the processes and the problems that you might have. But bottom line, stay connected.
Major Belcher, when we hear what the Sergeant Major just said, when someone comes to you, you said people usually bring them. Why don't they come on their own? And explain for people who have no contact with folks in the military, they were living and working before, why is there such an issue with transitioning back into civilian life?
It's a complete change in environment, those that are around you. In the military, we have a process of how we do things, how we accomplish things. In the civilian world, it's definitely set up a completely different mind. It's a complete mind shift, and so to go to one realm to the next and then having some. So that's a new environment to adapt to. And then how do I do that, especially when someone's been, say, deployed and witnessed all this trauma, and then I'm supposed to just come back and then, go to work and act like there's not danger around me. So that perception is very, that change and transition perception of one environment to the next is very difficult. And so there's also this mentality of, I don't want to feel or be perceived as weak. I don't need help. My comrade, my friend that passed away, or other people, that I served with, they went through way more trauma than I did. And I don't deserve to, I don't need help. I don't need help. I'm fine. And I can get through this. So it's a lot of this resilience of self to say, hey, I have to accept that this is going on in my life. That's a big step for someone to go step out and say, hey, I'm having issues in my life. This perception of I have to be strong, I have to be a stallion, I have to, I can get through this by myself. Like Sergeant Major was saying, we have to do it as a team. And so that's one of the things that it's hard for people to accept they have an issue for multiple reasons. That's why a lot of times it's the family member that brings them in. Or the one reason I chose to come here today here at the Veteran Service Center is because patients or veterans will come here and then they'll refer them to me for evaluation and treatment. And so it's so important to whatever community that the veterans are in to go to the Veteran Service Office. And these people are fantastic. They can empathize with the person and so they can listen to them and the person doesn't feel alone and they have to take on this themselves. And then once they open up about it, then it's, the big thing is avoidance. They don't want to think about it. They don't want to think about it. They don't want to talk about it. They don't want to be around it because it causes re-experiencing symptoms of that prior trauma. And it takes them back to that mindset and that era. And when that happens, they go into that primitive state of fight or flight response.
I want to switch over to Captain Ashworth real quick. Is that what you see? Do you echo what's being said?
Yeah, I think for the service members and veterans that are still actively serving, they're really concerned about career and what gets back to the military. And so they're being protective of their career. And there's a reluctance to seek treatment because they don't want their unit or their battery or their battalion or brigade, whatever flight wing, depending what service you're in or squadron. They don't want the military service to find out because they don't want it to impact their career, especially if they're looking at being a lifetime career. Once they have transitioned into the civilian life, there's a lot of things that we've learned in the military that keep us, like you don't show weakness, you're tough. Like you're able to handle these things. Like if you're a combat veteran, like how you how do you struggle with mental health and you're a combat veteran? And they struggle internally with a lot of these dichotomies and the stigmas. And I can't be crazy. I'm the one that was serving my country. I need to be able to have a higher purpose. I need to be able to stay connected. I need to be able to have my faculties about me. So there's a lot of this emotion that you see that plays into it. And a lot of times they're used to being the caregiver and used to being the go-to person in their family. So they don't want to be a burden to somebody else. And I think that that word right there is a key word. They don't want to feel like a burden to others. They don't want to feel like a burden to their family or to their friends. And that's what keeps them from seeking treatment a lot of times.
Well, as we wind down our time, gentlemen, I want to quickly talk to you. Captain, tell us what folks can do to help in Oklahoma, to help veterans and to help raise awareness.
I always say that you can do two things. One, Sergeant Major and Dr. Belcher both hit it on the head. Stay connected. Get connected in your community, get connected to the different military service organizations that are represented in your community. And a lot of times, that isolation piece, like make sure that you're being out and connected to others. And then when it comes to actually making a connection, have the courage to connect if you need help. And realize there's a lot of people out there that will be very protective of you, protective of your mental health and the issues that you're struggling with and the symptoms that you're experiencing. And just be willing to break down that stigma and take a step towards getting health. If you break an arm, you're not afraid to go to the doctor. If you have something going on emotionally, mentally, that's really taking a toll on you, have the courage. I mean, you have the courage to fight a war, have the courage to go take care of yourself and do the right thing so you can be able to take care of others later on.
That's a good point. Dr. Belcher, quickly, final word for folks in Oklahoma.
Don't be afraid to seek out help. It takes a lot of courage. You have courage. Suicide is not the answer. And it's okay to have those thoughts, how we feel and what we think. It's okay to have that, acting on them is a different thing. And how that affects the family and others. And so by showing courage and stepping out and going and seeking and help, you're actually helping others by going and getting help yourself. So my heart and prayers go out to everyone in Oklahoma and across the nation, all the veterans. And if I can ever be of service through Source of Psychiatry, I'm not promoting myself here, but I'm always an open ear to listen. Here in Taylor County, Brian Massey, here, the director of the Veteran Service Office, is a wealth of information, just like in your local community that your veteran service officers. That's why they are here, is to help others, because they've been through it too, and they can empathize, and they're there for you. So please take advantage of that. And God bless you all.
Thank you. And Sergeant Major, final words from you, sir.
Help us save the lives of veterans who are either suffering from the emotional scars of combat or other overwhelming, stressful life experiences. And for all of you veterans who are just looking for someone to talk with, I say, open the door. Just open the door to one of the 12,000 American Legion posts all over the country. We are here, we care, we understand. Let us help, just like the doctor and the captain were just saying.
Wonderful. Gentlemen, thank you for being with us. Thank you so much for your service, and thank you for caring for those veterans who have fought for us. Thank you very much.
Thank you.
Thank you.